Welcome to my personal analysis of the Uworld question ID 3939. The patient, personal history. He is a 33 years old male. He is non-smoker, non-alcoholic. He does not use illicit drugs. The typical age for autosomal dominant polycystic kidney disease is 30 to 40 years old. This is the age where the symptoms arise, and the patient is within this range. He is non-smoker, and smoking is a risk factor for cardiovascular disease and chronic kidney disease. So he is not a smoker, and this might be modified if he's a smoker and you diagnosed him with autosomal dominant polycystic kidney disease. Alcohol damages liver, and this liver disease, the liver might be involved in autosomal dominant polycystic kidney disease by liver cysts or hepatic cysts. Past medical history is insignificant. There is no chronic diseases like hypertension or diabetes. He takes no medications that might damage the kidney like nonsteroidals or ACE inhibitors. Hypertension and diabetes are risk factors for cardiovascular disease and chronic kidney disease as well. So if he is having either of them, so you start controlling them properly. The patient is complaining of left flank pain. The question didn't mention anything about the onset or character or radiation or association. This pain might be due to infection, might be due to renal stone that might develop in these cases. Analyzing the pain by asking the onset and the character. Onset, I don't know exactly where might it start, but the character, it might be colicky, renal colic. Radiation, it might radiate to the groin. It might be associated with hematuria, it might be associated with dysuria. And you'd ask about frequency and urgency and these things. And that's why I brought this question. I like the questions where things are analyzed properly, because the purpose of the examination is to learn the clinical presentation. It's not to learn the association facts. Okay, it's great to know the association, but the thing is, if the patient is coming for you as a physician and he's complaining of something, you should do a proper analysis for this complaint. So the examination is omitted as well, is not mentioned in the question. But what I'm expecting to see in an autosomal dominant polycystic kidney disease patient, that there might be hypertension, so blood pressure would be useful, and temperature as well to see if there's an infection or not. By palpation, you might see palpable masses. These are the renal features that might be present in this case. So not mentioning them is weird. This is a clinical case. I would like to learn the clinical presentation. You might say there is a palpable mass or there is no palpable mass, but not mentioning it at all is something I wonder about. This is why I brought this question, because I like the questions that mention things related to actual clinical practice, because this is the purpose of the examination. Do not forget this. You would like to learn the presentation, because once you become a physician, you start applying these patterns and recognizing them. And this would be helpful if you mentioned everything about the case. The investigation requested is ultrasonography, and there is bilateral multiple cysts. Why did you ask for ultrasonography? Maybe because of the renal stones. You think about renal stones, you request ultrasonography or non-contrast CT scan. And by ultrasonography, there is bilateral multiple cysts. He didn't mention this, but it's clear on the photo, on the picture. You need to recognize this. And it might come as a report from the radiologist. He might tell you there is bilateral multiple renal cysts. And this is a characteristic finding for autosomal dominant polycystic kidney disease. How do you manage this case? That's the thing. In the explanation, he's telling you control risk factors for cardiovascular and chronic kidney disease. Why? Because you want to preserve the function of the kidney as much as you can. What are these risk factors? Like hypertension, diabetes, you would like to control them. And obesity, smoking, these things are modifiable risk factors. Hypertension, if it developed, you would give ACE inhibitor. Why is it preferred rather than beta blockers or any other form like calcium channel blockers? Because what causes hypertension in this case is renal ischemia, because cysts compress renal tissue, renal interstitium, so renin increases, aldosterone increases, so the function of aldosterone can be blocked by blocking angiotensin converting enzyme, because this is something related to the pathway of generating aldosterone. If end-stage renal disease ensued, and it might happen when the age became 55 to 60 years old, so you would do a hemodialysis or a renal transplant. Another things like pain, this is the thing, like he's coming with pain. How do we treat this? How do we handle this? We would give pain medication. We would like to avoid non-steroidal because it might be harmful to the kidney, but we would give pain medication. If there's a UTI or stones, these might be the cause of the pain, so we treat it accordingly. If it's a urinary tract infection, we give an antibiotic. If it's stones, you try to give according to the type of the stone, you treat it, and according to the size as well. Hematuria, you would manage hematuria just in case if it's severe and it's heavy. Then you might do embolization or nephrectomy. Why I mention these things? Because the patient is complaining of pain. So how would we handle this? This is a question. Because I think questions need to focus more about the patient. It must be patient-centered rather than fact-centered. Okay? Because the question could simply ask, what are the associations of autosomal dominant polycystic kidney disease? And it would be cerebral aneurysms. And cerebral aneurysm can cause intracranial bleeding, like subarachnoid hemorrhage. But there is no regular screening recommended for such cases. We don't scan for cerebral aneurysm. There is association with hepatic and pancreatic cysts, mitral valve prolapse and aortic regurgitation, hernias, ventral or inguinal, and diverticulosis. This is a straightforward fact. It could have been asked directly, but in the case presentation, I wanted it to be full and comprehensive. And that concludes our discussion on this question. Thank you and good luck.